At 4 minutes past the hour. Um, I'm really, really happy to welcome all of you today. Our moderator, Sangeeta, is actually stuck, but she is in fact logging on as we speak, and I will hand over to her once she is here. But just for now, just to say a very, very warm welcome to this session on prevention and response interventions for technology-facilitated gender-based violence, the launch of the Systematic Review and Evidence Gap Map, which we are thrilled to be launching today. I think what I'm going to do right now is immediately hand over to our partners in this project to give some opening remarks. I'm really happy to hand over to Tuduetso Mokatle, who is the Technical Advisor for Data and Evidence with GIZ's Partnership for Prevention of Gender-Based Violence in Southern Africa. Her work supports regional efforts to strengthen evidence generation, knowledge translation, and data-driven decision-making for GBV prevention across the SADC member states by advancing the alignment of national and regional data systems with the SADC GBV prevention strategy, supporting multi-country GBV research and ensuring that evidence is translated into actionable insights for policy and program implementation. Previously, Tudu served as senior lecturer in monitoring and evaluation at the Institute of Development Management, working with government, civil society, and international partners, including WHO and UNESCO. Tudu, over to you for some opening remarks, please.
Good afternoon, colleagues. Thank you, Aisha, for that introduction. It's truly a great pleasure to welcome all of you to this important webinar on prevention and response interventions for technology-facilitated GBV. On behalf of the SVRI and GIZ's PFP, which is the Partnership for Prevention of GBV in Southern Africa, I really thank you for joining us, especially as we gather here today during these 16 days of activism against gender-based violence, which is really a moment when there's global attention focusing on ending all forms of violence against women and girls, including TFGBV. As digital technologies continue to transform the world that we live in and how we connect, we're also witnessing at the same time a rise in online and technology-facilitated violence, which is disproportionately affecting women and girls. This concern is also recognized in regional and continental frameworks such as the AU Convention on Ending Violence Against Women and Girls, and including the UN Women's Global Efforts in the 2025 16 Days initiatives focusing on digital safety. The Africa Shared Research Agenda also recognizes TFGBV as a key emerging priority area requiring stronger evidence, research like the one we're going to discuss this afternoon, and investments in the African context in general. So today's webinar is really to introduce the new work led by Emory University, which is the Systematic Review and the Evidence Gap Map that will bring together global evidence on interventions designed to prevent and respond to TFGBV. So this webinar really, the aim of deepening our shared understanding of the evolving research and evidence landscape and exploiting opportunities for stronger collaborations as we conduct research, as we practice, and also in policy in the digital ecosystem as a whole. So I'd really love to express our sincere appreciation to the Emory University research team for leading this much needed work at this time, and to all of you for being part of this very timely conversation, because it's through these partnerships that we can continue advancing our efforts to end GBV and build safer digital spaces where everyone can participate freely and safely, especially women and girls. So I thank you for joining us, and I really look forward to a thoughtful and insightful session. Thank you.
Thank you so much, Turu. And I think what we're going to do now is I'm actually going to introduce myself, and we're going to go straight over to a brief overview of SVRI's work in the TFGBV space. As I said, I'm Aisha, and I'm the Global Advocacy Director at SVRI, and I have over the last couple of years been leading on our TFGBV initiatives. And I'm really thrilled about this launch and really excited to kind of give you an overview of where we've been and where we're hoping to go and why. And I'm going to set myself an alarm because otherwise I'm very bad at going over time. So it will ring a bell. And Paula, if you don't mind sharing the presentation, then I will jump right to it. Wonderful. Thank you so much. And we can go to the first slide. So I'm just going to talk about, I'm going to just give a quick snapshot of our TFGBV initiatives and show how they're shaping our current work and the path ahead. And just to start, I want to acknowledge and comment on the fact that we know that tech-facilitated gender-based violence is growing faster than our collective ability to prevent or respond to it. We know that technology brings extraordinary possibility, but also profound harm, especially for those already marginalized communities or those who are not included for a whole set of reasons. At SVRI, we really want to acknowledge that the digital world, however, is shaped by us, our own design choices, our engagement, our silence, our action, or our inaction, which means that we also have the responsibility and the power to try as hard as possible to reshape those worlds in the way that we want to see them developing. Our new strategic plan deepens our commitment to low and middle income country-led research and to amplifying diverse voices and to making sure that we strengthen the pathways that translate evidence into real-world change. And it also places interdisciplinary collaboration at the center, which is, of course, especially important for TFGBV, which sits at the intersection of technology, gender, human rights development, something that no single sector can solve alone. And TFGBV is very much a cross-pillar area of work at SVRI, and I will demonstrate that to you now. Next slide, please, Paula. So from the different things that we have already done and the work that we've been learning from, there are certain key areas, or better to say, overarching issues that have emerged. And the things that have emerged have shown us that what we really need is a very joined up field building approach to tackling this issue. One aspect is, of course, addressing the lack of quality evidence on what works. And this isn't only about the evidence gaps, which I will talk more about in a while, and which is, in fact, of course, what this whole session is about. But it's also about noting that there is an absence of methodological rigor, of ethics, and of gender analysis in technology-focused research that is currently taking place. And that's something that we as a field do need to address cross-sectorally. And you will hear more about this in the presentations after me today. A second area is addressing capacity issues. Ethical and appropriate methods are really critical in this rapidly shifting landscape because we need to ensure that research captures the complexity of TFGBV, and that means dealing with lots of methodological concerns that we haven't had when we are working in offline spaces, so new ones as well as the common ones. And we also need to protect survivors and vulnerable communities while we're doing this, and the field definitely needs support on developing these capacities, as do things like ethics review boards in different countries. We do need to talk about breaking down silos. We have to speak to different sectors. And what we find is even within the GBV field or the TFGBV field, the researchers, practitioners, policymakers, tech actors are often working in parallel. There is a lot of duplication of efforts. Sometimes we don't have shared goals, terminology, or platforms for communication. And this is something we need to address in an overarching way. And finally, looking at systemic barriers to change. So looking at weak government regulation, limited enforcement, the immense power asymmetries between civil society and tech companies. And when we're talking about tackling systemic barriers, and this is also linked to the silos point, we really do need to link our work to broader global debates on digital justice, on data governance, on inclusiveness, to make sure that the voices of survivors and marginalized communities are actually shaping the digital world that we're trying to build. So next slide, please, Paula. So here I'm going to start looking at the evidence. And under our building evidence pillar, we've identified a whole bunch of gaps. Despite increasing attention, despite the fact it may seem that everybody is working on this, many important gaps actually do persist. So one, the whole thing of many studies still focusing on short-term effects. We still don't know very much about the long-term psychological, social, and economic impacts of TFGBV. We do not have very much evidence from low and middle income countries, which means we're risking solutions that aren't grounded in the realities of diverse socioeconomic and cultural contexts, including in the realities of lack of access in some places at a very basic level. Research that is out there often uses non-comparable definitions and tools, and that makes cross-country analysis difficult. there is a huge gap in terms of understanding of motivations, pathways, and social environments that facilitate perpetration online. And indeed, algorithmic bias, which we know exists, is underexplored. We need deeper inquiry into how tech design choices specifically perpetuate harm or silence survivors. So our work in these areas has included the research agenda, then funding the evidence base, specifically in low and middle income countries, the evidence resource hub, which we've supported, and the gap map, which you'll be hearing so much about today. Next slide, please. So in the interest of time, I'm not actually going to go into the research priority setting process and everything that we found there, but I do want to highlight that it has been a really important part of SVRI's work in this area. And we have used our understanding that we've developed from the research agenda to build other work that we've been doing. We have been heartened to see that the agenda has been used by different groups. It's been used by funding groups to fund specific grants in the area that have been guided by the research priorities. Our own funding is also guided by this. And research and practitioners' feedback has also come to us saying the agenda has been extremely helpful in providing a framework, in providing a direction that is authoritative, that people believe in. And organizations have used the different domains as a way to frame their own research. So we know that the agenda is being used. Next slide, please. So also under building evidence, we actually have multiple studies underway in low and middle income countries. And each of these actually addresses critical gaps that have been identified in the research agenda, from conceptual frameworks and definitions to online harassment, to cyber stalking, doxing in higher education institutions, disinformation, and also the testing of online prevention and response tools. And I just want to mention that we are incredibly proud of our grant partners' work, which isn't only building evidence in areas that we really need it to be built, but it's also showing us in real time what high quality, ethical, and impactful TFGBV research actually needs and can look like. And we intend to create learning from this for the field. Next slide, please, Paula. Another part of the building evidence pillar is the supporting of the development of the evidence resource hub within the data and evidence subcommittee of the Global Partnership for Action on Gender-Based Online Harassment and Abuse. I'm always proud of myself when I say that in one breath. They have been mapping work that members of the Global Partnership have done and are doing on TFGBV in the past and are planning in the future. And they're looking at identifying areas of potential synergies. And there are two current focus areas which are being looked at. And that is mapping what is known and not known about men's perpetration of TFGBV. As I've already mentioned, it's a noted gap in the field. And working with membership and advisory group of the Global Partnership to identify what are the overlaps, what are the opportunities among different sectors who are working to prevent TFGBV. And again, that whole intersectoral thing we think is very important. Next slide, please. Now, just quickly to talk about our capacity strengthening pillar and what we're, just very briefly, a few of the things we're doing there, because our work doesn't stop at building evidence. We're also really focused on strengthening capacity within the TFGBV research field. And I've already mentioned why. But we really do need to make sure that researchers are properly supported. And towards this, we are planning a specific mentorship program on this issue, as well as allocating resources to a bespoke capacity strengthening program that specifically looks at working with current grantees and ensuring that research evidence and findings are widely shared and are widely utilized to influence policy and supporting those processes. Many of you may already know we also launched this publication in partnership with Mertech in March of this year, which is guidance on responsible use of AI in research on violence against women and violence against children. And we really hope that this will assist people who are interested in and who may be worried by how to use AI, especially how generative AI is changing our ways of working. So that's just briefly about our capacity strengthening. Next slide, please, Paula. Under promoting partnerships, I just want to quickly mention Forum, because at Forum 2024, we really saw how quickly the evidence base is actually growing. And there were so many presentations on TFGBV and AI, the nature of TFGBV, digital responses, survivor-supported technologies. And to keep that momentum going, we hosted then follow-up webinars with presenters from the forum, which was an amazing way for them to share their work more widely and also to help people who could not get to the forum stay connected to the latest thinking on this. And of course, this is what Forum does best. It gives us a space to hear new evidence, to talk openly about the challenges, and really to strengthen each other's work. And I think with how fast AI and digital tech are evolving, we are expecting even more interest on this at Forum 2026, where TFGBV will, of course, continue to be a very big theme. Next slide, please. And finally, I just, in the interest of time, I will not go into this, but just to say, I wanted to quickly mention the community of practice on TFGBV, which is an important part of what we've been doing. It has now grown to more than 1,000 people. We've recently completed a successful collaboration with UN Women. Hopefully, some of you have attended one of the 6 policy dialogues that involve stakeholders from government, research, practitioners, activists, and hundreds of people attended these policy dialogues. And we have actually we have gathered a very rich set of insights and messages very gratefully. And these will be used next year to inform advocacy through both the ACT platform and other platforms. And what we're really hoping is that the community of practice is going to grow into a stronger model for exchange and output-driven work through a working group model as it evolves next year. So that's actually it from me. I just want to conclude, I just want to say that we are, of course, on a journey with our TFGBV work. And this is just a very, very quick whisk through some of the key points. And I know many of you are also on that journey. And for SVRI, we really do see that the path forward is quite clear. It's research that's ethical, global, and survivor-centered. It's about building diverse coalitions, cross-regional learning, encouraging guardrails to be set that really do put safety before profit, and very importantly, ensuring that those most affected are shaping the solutions. We have built this digital world. It is not separate from us, and together by our choices, we can actually make this world safer, more inclusive, and more productive for everyone. Thank you so much for listening, and over to you, Sangeeta.
Thank you so much, Aisha, for that great overview of the work that SVRI is doing in this area. Hi, everyone. I'm Sangeeta Chatterjee, and I am the Research Director for SVRI. And I'm so glad to join you all here. And I'm very pleased to introduce the research team that has conducted this fantastic systematic review on TFGBV prevention interventions. And so before I hand over to them, I'd just like to introduce the team. So first off, we have Alexandria. Alexandria is a data analyst with a PhD in quantitative methods from Vanderbilt University and has 5 years of experience collaborating with interdisciplinary teams. She's passionate about applying her expertise in multivariate statistics, study designs, and data synthesis to address critical questions about health and well-being. Our second panelist, Dabney, is an associate professor of global health at Emory University, whose work examines the intersections of gender, health, and human rights. Trained in public health and law, she uses mixed method approaches to study a variety of issues such as technology-facilitated gender-based violence, intimate partner violence, and femicide across global contexts. Carrie, our last panelist, is an associate professor of global health at Emory University, whose work centers on the measurement and epidemiology of intimate partner violence and related social norms. Trained in both anthropology and public health, she evaluates prevention strategies across global settings and has authored more than 140 reports and peer-reviewed publications. Thank you so much, team, for doing this fantastic piece of research for us, and over to you to take us through the research findings.
Wonderful. Ali is going to be sharing our slides in just 1 second. So thank you all. It's my pleasure to open our panel on this systematic review and evidence and gap map that we produced for SVRI with support from GIZ. It's really an honor to be able to work on this topic because, as it was mentioned, it seems to be everywhere and the problem is growing. And our ability to keep up with it is going to be our greatest challenge. Looking at the introductions in the chat, I can see that so many of us here are doing this work. And on our side, we're presenting results because we are applied practitioners with a very specific focus on evaluations. So, and we are presenting here on behalf of a larger team at Emory University, many of whom are probably also in the chat. Next slide, please. So you already heard that there's an ongoing challenge in the field around nomenclature, around definitions. We are centering our work here using the UN Women and WHO definition of technology-facilitated gender-based violence with an emphasis on gender. You see here in the box, I'm going to read it out because it is quite comprehensive and one of the most widely used versions. So technology-facilitated gender-based violence is any act that is committed, assisted, aggravated, or amplified by the use of information communication technologies or other digital tools that result in or is likely to result in many types of harm, as mentioned here: physical, sexual, psychological, social, political, economic, or other infringements of rights and freedoms. So I read that out because it is comprehensive, and it is the outcrop of a fair amount of deliberation, possibly involving many of the people in this webinar today. On the other side, this is just a word cloud, but speaking to the definition and what the topic that we're working at, it is really complicated because there are so many different terms that are being used to reference very specific or more general forms of technology-facilitated gender-based violence. So I just put this out here because it is the definition, while encompassing, is the overall umbrella of a phenomena that is multifaceted, multi-typed, and for a systematic review and trying to be very comprehensive, we did our best to try to get every type of term available, but feeding into the conversation about nomenclature and some sort of standardization of the way we refer to these acts would also help us to better summarize the literature and not be redundant or accidentally ignore important literature simply because of terminology. Next slide, please. So as you've already heard, we originally undertook this with the funding, as you've already mentioned, with a focus on the South African development community as the focus. We quickly broadened our focus to do a global review to ensure that we had sufficient evidence in which to try to summarize. But this work fits into this sort of growing evidence base, but also strategies to identify priority areas for investing resources to understand what works to prevent and respond to TFGBV. Next slide, please. So why are we doing this? You've already heard some of the background. I'm going to throw out a few of the statistics. While we don't have a definitive prevalence estimate of all forms of technology-facilitated gender-based violence, there is growing evidence of the size of the problem using different subcategorizations and terminology. So the first one that you see up there on your screen, this is from the Economist Intelligence Unit, and they did a survey of 51 countries with the highest penetration of the internet, and they found that 38% of women 16 and older had reported experience of online abuse, and 85 had witnessed technology-facilitated gender-based violence online, which would have again been using the nomenclature online violence. In a very recently released systematic review and meta-analysis focused on sexual violence, technology-facilitated sexual violence, we see that in these three forms that you see listed here, from between 6% and 29% have experienced some form of sexual violence that is technology-facilitated. So when we think about the definition, we are centering gender because we're working with a construct that, while the epidemiology is still percolating, we find that it's this online manifestation of what we have in the real world, which is violence that disproportionately affects women and girls or marginalized groups. And it's fueled by power imbalances in the real life and the online life, which are just, extensions of the same phenomena. So that is why we're using technology-facilitated gender-based violence nomenclature, because we do think gender matters. So putting that out in the forefront. And as you already saw from the definition, we have burgeoning evidence that there are numerous consequences to technology-facilitated gender-based violence to the individuals, but also to the community. And when we see individuals dropping out of the internet or using apps to protect themselves, they are losing access to information in an information economy. So the harms are tremendous. But we also find that technology-facilitated gender-based violence also fuels misogyny online and creating community impacts that go beyond individuals who experience it. So this is where we are situated at this sort of nexus of trying to figure out, we have a growing epidemiology of understanding prevalence, risk factors, outcomes, responses. And our job, our task was to try to figure out where we are in the evidence base in terms of what works to prevent and respond to technology-facilitated gender-based violence. Next slide, please. So we have the two main aims, which was to synthesize the data on prevention and response interventions for TFGBV with a global focus, without restrictions, and to understand the strengths and gaps in this evidence base. And this is what we're going to be presenting today. So thank you so much. And I'm going to turn it over to my colleague, Dabney.
Thanks, Carrie. And I'm going to try and breeze quickly through these slides, which I'm going to present some of our methods and our results. But just know that these data are going to be available in a research brief that will soon be posted on the SBRI webpage, along with our evidence and gap map, which we'll be demoing quickly. So just to give a little bit of background on our approach, I'm going to focus here on the systematic review, and we'll talk about the evidence and gap map shortly. We conducted a search of 8 academic databases and 13 gray literature sources for studies related to TFGBV interventions. And we did not place any limits on time, location, or language. So this was really an open search. In terms of the eligibility criteria, the interventions were any intervention to either prevent or respond to TFGBV. And the populations for the purposes of prevention were any population, while those that were focused on response interventions had to include prior TFGBV victimization or perpetration, depending on the subject or the population of focus. The design included quantitative, non-randomized trials with comparator groups, and our outcomes were focused on TFGBV victimization or perpetration. Next slide. We followed the PRISMA guidelines, and I'll show you our PRISMA chart in just a moment so you can see a little bit more about our process, but this is just to support the rigor of the process that we work through. And we conducted double screening and data extraction with a third reviewer resolving conflicts when necessary. We identified over 9,000 studies, and of those studies, 37 met full inclusion criteria, focusing on explicitly on victimization and perpetration interventions, as I mentioned. And for the purposes of quality assessment, we used an adapted tool from the National Institutes of Health to assess quality. So this is just an overview of our PRISMA flowchart, and you can see that we removed duplicates and, as I mentioned, went through a process where we screened abstracts and did full text review using 2 reviewers, as was mentioned. Next slide. So after doing that process, we ended up with 37 studies, and we thought really important to point out that only 2 of these studies took place in low or middle income countries. So that's a really huge gap that we wanted to highlight right off the bat. Of these studies, 8 were geographically unbounded, meaning that they took place entirely online, so they didn't take place in a particular country setting. And 2 of the 37 studies were systematic reviews. Next slide. In terms of the results, among these 37 studies, 27 were randomized control trials, 8 were quasi-experimental design studies, and 2 were systematic reviews. And this is consistent with our inclusion criteria for the types of designs that were eligible. And in terms of the focus of the studies, 28 of the 37 were focused on prevention, and 9 were focused on response to TFGBV. Next slide. We also wanted to look at the delivery modality. And so what you'll see here is that 15 of the interventions were delivered in person, 15 were delivered via a mobile app-based tool. Some 4 included a combination of these 2 strategies, so either in-person or mobile-based. 1 took place on the web, and 2 approaches were policy approaches. And then of those that took place with an in-person delivery strategy, 15 took place in school-based settings, and then a smaller number in each of the categories, one study each in household, a research center, a community setting, or a healthcare setting. Next slide. When we looked further into our results, in terms of comparison group, what we noted is that most often the comparison group was treatment as usual or the existing standard of care or no other intervention. There were a few studies that included alternate interventions as a comparison group. The populations that were the focus of each of the studies were mostly on youth. 22 studies focused on youth, 8 focused on perpetrators of TFGBV, 5 studies focused on people at risk of TFGBV, 3 were aimed at the general public, and 3, specifically those focusing on childhood sexual abuse material, were focused explicitly on adult men. The follow-up varied widely across different studies, and the most common follow-up length occurred immediately after the intervention, and we'll talk further about that in our implications. But there were some studies that had longer follow-ups that included up to a year out after the intervention. And the quality among all the studies also varied substantially. So 3/4 of studies did not report on blinding, less than half of the randomized control studies provided randomization information, and less than half of the quasi-experimental design studies adjusted for covariates in their analyses. Next slide. And I'm going to turn it over to Ali to pick it up from here.
Thank you, Dabney. Sorry, I have a little bit of a cough, but we'll get through it. In terms of the intervention effects, this table, we're going to spend a little bit of time with it because it's one of the cruxes of the findings that we had from our systematic review. You can see here this table looks at the included studies by TFGBV type here on the rows and whether or not the study looked at victimization or perpetration. Let me go back a slide here. In general, most of our studies, the majority of our studies focused on perpetration over victimization, although some studies looked at both types of TFGBV outcome. And you can see here in the table that there was substantial variability in the body of evidence by TFGBV type. Several studies looked at cyber dating or partner abuse, child sexual abuse material, that is CSAM behaviors, and hate speech or slurs were some of the common TFGBV types included in our systematic review. In terms of gender differences, very few studies focused or looked at intervention differences by gender. Some studies included only men or women in the in the study, but generally gender was largely not a component of the studies that were included in our systematic review. What we noticed also from our results was that there were substantial differences in the intervention effect by the TFGBV type. So, for example, the CSAM behavior studies and the hate speech and slur studies, we can see that for the studies looking at these TFGBV outcome perpetrations, that the majority of studies found some sort of beneficial intervention effect on perpetration of these TFGBV behaviors. However, TFGBV types such as cyber dating or partner abuse and child grooming, where we were also seeing a larger body of evidence, generally found null effects, so no intervention effect for these TFGBV outcomes. We also found that there were a few studies that focused on some of these types of TFGBV. For example, non-partner cyber abuse only had one study on perpetration, none on victimization. Cyber sexual abuse only had one study on perpetration, unwanted sexting, and despite having search terms to search for some of the more specific technology-facilitated forms of violence like doxing, sextortion, we found no studies that met our eligibility criteria. So we could not look at intervention effects for those TFGBV types. There is further learnings to unpack from our study, but the immediate implications that fell out from our analyses were a need to invest in interventions in lower and middle income countries, as we discussed at the outset of this presentation. These countries are the least represented in the literature writ large, have the largest share of the global population, and have some, as far as we can tell from the evidence, possibly the larger burden of TFGBV exposure. Additionally, we need additional research on high risk and marginalized populations. Several are listed here. It's also worth noting for our response interventions that we found 9 of them, 7 of them focused on perpetrators. So only 2 of the studies that we found looked at interventions to support survivors. So this is another at-risk group that we found limited intervention support for. We also need to examine gender differences in the intervention effects and focus on how gender and other identities intersect with these intervention effects. And then, as I indicated on the last slide, we tried to find interventions for a broad range of TFGBV forms, but our systematic review largely found a subset of those forms. So additional interventions need to be tested in a rigorous manner on these newer forms of TFGBV that maybe are conducted solely in the online space, such as doxing, sextortion, image-based abuse, non-consensual image sharing, etc. And as Dabney said, most of the studies that we found that met our criteria were either short intensity studies, so relatively short interventions, or had very brief intervention follow-ups. So we need to be moving in the opposite direction because longer term impact interventions and higher intensity interventions are both associated with stronger behavioral change. And then we need to collaborate across disciplines. Our systematic review found what we already kind of knew from this space, that a lot of people are targeting this, this topic and trying to make positive change for TFGBV, but they're doing it within their silos. So we found evidence from the computer sciences, the social sciences, and the public health sciences, but the types of interventions might look different for these different fields, and collaboration across these fields will accelerate the rollout and scale up of interventions available to address TFGBV. I'd like to also now show our evidence and gap map. So let me close out of the presentation. This evidence and gap map is publicly facing. You can find a link for it on the SVRI website, and I'm sure we can drop it maybe in the chat as well. This has been a lot of information, I know. The evidence and gap map covers some of the findings that we went through quickly today. I am going to scroll, though, to the bottom to look at our visualization of the evidence that we found from our systematic review. This is the evidence and gap map. What you can see here in the gap map is on the rows, intervention delivery modalities. So in-person, web, mobile, policy, and combination intervention delivery modalities. And on the columns, you can see different types of TFGBV outcomes. What you can see at the intersection of the rows and columns is where there is some sort of body of evidence. Where you see a gray square is where there are no studies at this intersection. So for example, we found no studies that were looking at in-person interventions for image-based abuse. Where you see these smaller colored squares, these indicate that there is some sort of study that met our eligibility criteria at this intersection. So for example, we had 4 studies that were looking at web-based interventions for child grooming. And the color of the square indicates the type of study: randomized control trial, quasi-experimental design, or systematic review. You can also click in to a particular square and read about the studies that we found, their abstracts. You can link to the study itself as well. And then you can also download any references that you would like that might meet your use case. You can see all of the studies that were included in our systematic review if you just click on the View Records. And then finally, the feature I wanted to show as well for the evidence and gap map is this filtering option. So say that for your use case, it's important to only show randomized control trials. and maybe the prevention interventions. You can select these filter options and then update your map, and it will now hide any of the studies that don't meet your filter criteria. And you can see where the gaps are in these further breakdowns of the studies that were included. And I'm just going to clear the filter now to re-show the map. If you want to, excuse me, you can also export the records associated with whatever use case is most important for you. Damni also mentioned our research brief. It is now linked in the Evidence and Gap Map website itself. So this short brief goes over a lot of the findings that we touched on today, as well as our implications. So you can read about them here. And I think that that is it for me. I think we will maybe turn it over to questions now. But I will put the map on display.
Thank you so much, Ali. And if anyone has questions, please feel free to pop over to the Q&A function at the bottom of the window to post your questions. And we do have a couple of questions. I can go ahead and ask the first one. Are there any specific prevention interventions from this review labeled as beneficial that the team would highlight as interesting or innovative?
Perhaps I'll jump in here. So I would say, I would sort of couch the answer with what is innovative for the particular discipline. For example, the chatbot, honeypots, or the more traditional work in schools, curricula, some completely paper-based and others online. So I think it's what would be innovative would be based on what is more common for your field. I think the brief, it's very brief, and there will be a peer-reviewed manuscript out, we hope soon. Hasn't been rejected yet, but it's only been 24 hours, so there's still time. But there will be we'll be posting that publicly as well, which will go into a little bit more detail around this. But I would say, look at the brief and look at the range of types of interventions, because they are all super interesting in that respect.
Thank you so much, Carrie. We have a couple of other questions. One is asking about sort of what areas are under-researched, particularly in the global south. I know that's a super broad question, but if you could highlight some areas, if that is possible.
I'll jump in here. I think that, one of the things that I would underscore is that there were several forms of technology-facilitated gender-based violence where we didn't find any studies. So as you looked at the evidence in Gap Map, and Ali pointed out those squares that are just completely gray, it doesn't mean that there's no research, right? It means that there were no studies that met our eligibility criteria, meaning that they were interventions focused on either prevention or response. So for me, some of the ones that are, forms that are emerging, cyber flashing, sextortion, doxing, things that we sort of expected to see in the literature, perhaps because these are things that we tend to hear about a lot. Online grooming is another example. But we didn't see any intervention studies. Again, it doesn't mean that they're happening. Maybe they're in progress. They haven't been published or results aren't available yet. But we definitely, as of this moment, have some big gaps. And of course, these technologies are changing quickly, right? Especially with the onset of AI, the ability to do sort of deep fakes. And there are now very troubling platforms. I heard that ChatGPT is going to allow for sexual-based conversations, and there are also platforms that can, for example, undress people based on a normal photograph where someone is wearing clothing. So I think that this field is so rapidly emerging, and the forms of technology-facilitated gender-based violence, there are huge gaps in the ones that we know about, and more to come in the areas that are still coming forward. So we need to be as creative and innovative and quickly moving as the technology is possible.
Thank you, Dabney. And that's a big challenge. And hopefully, funders are also listening to this as we discuss these issues. One question that we have from Felicity is asking for recommendations for nonprofit organizations who are working quite hard to investigate TFGBV and its harms and roll out sort of interventions. What are some of the recommendations you would have based on your work?
So I can jump in here real quick. First, I would say SBRI, I think, already has those recommendations in terms of survivor-centered, ethical, and evidence-based. So part of our job is to summarize the evidence and the process of the evidence and gap map, making this work public is part of this process of making sure that we're all aware of what is going on. For example, in many of the studies, there's no mention at all of ethics, which for certain disciplines to even get approval to evaluate something, we would have to have gotten ethical approval, and that has many, many dimensions. But in terms of the workspace, this is where you all are on the cutting edge of addressing this issue. So honestly, I think this cross professional dialogue and support is going to be critical, and so much of what SBRI is trying to do to get the word out in terms of what are the pillars of good programming. From an academic, 20 years working on gender-based violence prevention and response, we know what works. We have a strong evidence base of what works and what doesn't work. And when Ali mentioned that some of the interventions show effectiveness, but it's only measured at the end of a few minutes, or for some of the interventions, or at the very end of the curriculum. And it's really lasting change on the person level that's going to get us to prevention in the longer term. So I think the communities of practice and opportunities to truly collaborate, which I think SVRI and many others, UNFPA and others in the field, are trying to bridge those divides, because I think collectively is where we're going to be able to move more quickly. And in terms of the inclusion and criteria, which was also one above, Ali, could you throw that into the chat?
Yes, I can.
I'm ashamed to admit that I tried to do it myself and somehow messed it up.
It's fine.
In a technology facilitated gender-based violence presentation.
Zoom is not always intuitive here. We have another question from another attendee who is asking if you've seen any studies dealing with TFGBV towards LGBTI plus people, for example, threatening to out them to their family, in your review.
So, go ahead, Karen.
No,
was just going to say that you saw in one of the slides that I shared the populations of focus. And so we did not see, and I see a few things, other things coming up in the chat in terms of people living with disabilities and other sort of subgroups that might be at higher risk based on gender-based violence more broadly. So we did not see, with the exception of youth populations, we did not see any studies focused on particular subpopulations like LGBTQ people, people living with disabilities, other racial and ethnic minoritized groups that might face sort of intersectional threats based on their identity group. And we definitely think that these are important areas of research because we know from the field and gender-based violence more broadly that these groups are at higher risk. So really important gaps there.
Yes. Thank you, Dabney, and hopefully we can collectively sort of work on addressing these really critical gaps. We have another question from Claudia, who is asking, who noted that she's struck by the gaps that are similar to those between TFGBV and offline GBV, lack of long-term studies, inconsistent definitions and methods, and poor understanding of motivations. how can we bring things together in a continuum rather than splitting into forms? And what is sort of the space for more joined up research, which again is a big question and one that actually we need to tackle as a field. But I'm going to turn it over to the panelists first.
It's great to have you here, Claudia. Thanks so much for this question. I think, the way that I think about this is everything right now is sort of trendy with AI. It's kind of like the buzzword of the day. And I think one of our observations, right, is that technology facilitated GBV is just the same forms, or there are new and different forms. But it's the place where gender-based violence is taking place. So there are forms of GBV that are taking place in person and online, and those things can be similar in some ways. And there are also distinct forms that are happening only in online spaces. So I do think there is a little bit of a need to look at things that are happening exclusively online versus in both spaces. But for me, I think you're absolutely right that these things are connected. They're not, TFGBV doesn't live separately from GBV. And we do need to make sure that we're looking across both spaces in an integrated way. But Carrie, maybe you have more to add.
Yeah, so I think a number of us have ideas. The trick is getting us all in the same place, either virtually or in person. And when I say all of us, I mean survivors, advocates, researchers, researchers from the different disciplines, because we have political science, we have criminal justice, and you can tell, even just by the layout of the article, that we have very different ways of putting information on paper and what is required and what is not. And that's very disciplinary. But in terms of the foci of the work, it's very much derived from our unique disciplines, particularly since we do have so much evidence on what works to prevent violence and to change norms. To apply that in the online space, it just needs us to put our work together and our insights together in a way that we can produce interventions that are deeply, deeply evidence-based in terms of what we know works. I also saw a note in the Q&A about long-term funding, and I wish I were a funder. I would just give myself a ton of money and many other people that I know and love. But the longer term efforts are critical. They're critical, particularly in the in-person sort of space. It's, we look at evidence, we need to look out further. But when we think on the long-term space, because behavior change, social norms change, sometimes things take longer to have sustained change, and we know that. So short-term funding is it gives us some information, but it can be very misleading. For example, if you look at some of these online interactions, a one-off stopping someone from moving forward to access a site that has child sexual abuse material on it. We know that event right there is super important, but how do we know that person is somehow changed and not going to continue to do this? We don't. So there is evidence about how policy changes, for example, in some sort of rule change on a social media platform, does that reduce the issue, or does it just shift it to another platform, another sub stack or whatever? And there is some evidence that you can actually have some impact there, but there's much, much less of that type of evidence, much more of the very short-term, immediate types of effects on a particular action, which doesn't tell us at the person level. Ultimately, if we prevent violence, it's at the person level.
Thank you so much.
Sorry, I just wanted to add briefly, in addition to collaboration, I think a big issue with the bridging of offline and online gender-based violence research is the lack of measures. People tend to use measures that just look at one versus the other. And so finding appropriate and contextualized measures that look at both at the same time is a way to move the field forward.
Thank you so much, Ali. And, it's great to have this work done to sort of identify the gaps in which that we need to sort of collectively work towards to addressing. And it's great in some ways that TFGBV is being identified as a priority issue in so many different initiatives. And I think the challenge is now to figure out how we can come together as a field to sort of collectively speak to each other and then collectively address some of these gaps. And for us at SVRI, this is one of our many efforts to sort of be able to do that and hopefully highlight the evidence for you in terms of what works to prevent and address TFGBV. And we will update the gap map next year as well. So at least for the next 2 years, we will be able to showcase what the best evidence is out there. And we look forward to working with all of you to solve this issue together because we know that violence is preventable and we can work towards it. Lastly, I just want to thank you, the team, for this fantastic presentation. And thank you to Do and the team at GIZ for funding this much needed piece of work. It's only possible because of funders like you. I also want to acknowledge before we end that the Emory team pulled together this big piece of work in just 6 months. And so we're very grateful to them for doing this fantastic piece of work in this short time. And if there are any interventions that you have worked on in the field that you think we should include in the gap map, in the evidence review, if you go to the website, we have our email address there. Please email us and we will definitely include it. And, because we've been working on this only for the last 6 months, we do have intentions to do a deeper dive into these interventions in the coming set of months. So please stay in touch and subscribe to our weekly updates to stay updated with the many resources that we can offer to you to work on TFGBV. Thank you all, and thank you so much for being here. Goodbye.